on the food supply chain and the steps that we are all taking to ensure that everyone has access to the food that they need. We recognise that this is a challenging time and that there are many things that the government is asking the nation to do differently as we work together to fight this pandemic. However, there is one message I want to start with loud and clear this afternoon, which is be responsible when you shop and think of others. Buying more than you need means that others may be left without, and it is making life more difficult for those frontline workers, such as our doctors and nurses and NHS support staff, who are working so hard in such difficult circumstances. So as you shop, think of those who are finishing their late shifts and need to pop to the local shop at the end of a long day. Today, the Prime Minister and I have spoken to the retail sector. There is more than enough food to go round, and our food supply chain is able to expand production to cope with increased demand. In the last week, sales of some foods have increased significantly, and manufacturers have produced around 50% more food than they usually would. There is no shortage of food available, and more is arriving at shops every day. But the challenge that all of our retailers have faced is keeping shelves stocked throughout the day in the face of increased purchasing behaviour. We all have a role to play in ensuring that we come through this together. So the government has taken steps to set aside rules restricting delivery to stores and relaxed restrictions on driver hours so that more goods can be delivered to every store every day. And we have also set aside competition laws so that supermarkets can coordinate their efforts locally, sharing staff, sharing delivery vehicles, and coordinating their store opening times to ensure that food reaches every part of the country. We've also waived the plastic bag charge and for online purchases to speed up deliveries. Our retailers and food producers who supply them are working around the clock to keep shelves stocked and the nation fed. Supermarkets are recruiting more staff, protecting shopping time for older and vulnerable people, and limiting shopping hours so they have more time to restock. And I want to take this opportunity to thank all those staff working in our supermarkets and food businesses up and down the country today who are doing so much to deliver such a crucial service to us all. But as the Prime Minister has said many times, we need every citizen of this country to play their part too. Some supermarkets have put in place purchase limits on some items to ensure that there is fair trading and that their shelves remain stocked for longer. Everyone must respect such measures and respect the staff working in these shops who are doing their best to ensure that both you and your neighbours get the food supplies that you need. Thank you. I'd like to pass over to Helen now.
Thank you. Thank you. Just to pick up on a couple of points there. Firstly, I mean, you don't need me to tell you about the sort of levels of unprecedented demand that we've all seen. And I really wanted to reassure everybody that people right across the food industry, from growers, packers, producers, distributors, drivers, and the people right at the front line in our stores are doing everything they can to make sure that we have the food that we all need. And it's almost like we're seeing basically a peak in demand like Christmas without the 4-month build-up in planning that you would normally have in advance. And we've been able to do that in 2 weeks. There is plenty of food in the supply chain. The issue is around people and lorries, so getting that food right into the front line, onto our shelves, which is why we've seen shortages in some areas across lots of different lines in different areas of the country. What's been vital over the last few days is the dialogue that we've had with government. They've really listened carefully to the things that people across the industry have highlighted that would make it easier to increase capacity. The key is, I guess, not just that listening, but being able to act quickly. And George has highlighted there a couple of things. I mean, for example, lifting curfew hours for deliveries has enabled much more lorries to get through the supply chain and into stores more quickly. And there's a whole list of things where we've raised an issue and it's been addressed quickly. And I think that is going to be vital as we go forward over the coming few weeks. And I think the food retailers that I'm talking to every day, and on the call with the Prime Minister earlier, really wanted to underline that message about, in encouraging everybody to really be considerate in what they buy, make sure that they only buy what they need. There is £1 billion more food in people's houses than there was 3 weeks ago, so we should make sure we eat some of it, and be considerate, and also think about other people right across your communities and how we can all help them in making sure that they can pick up and get their shopping. And so I think it's much more about how we all work together to rise to the challenges that we're facing.
Thank you, Helen and Stephen.
Thank you. So I would just like to make a plea on behalf of all my colleagues in the NHS, nurses, doctors, paramedics, and many, many others who are working incredibly hard at the moment to manage this outbreak of coronavirus and are preparing for the surge that they know will be coming at them. It's incredibly important that they too have access to food, to those essential supplies that they need. I'm sure many of you will have seen a video posted on social media yesterday by Dawn, a critical care nurse who was in tears at the end of a long shift because she could not get access to the supplies that she needed. And frankly, we should all be ashamed that that has to happen. It's unacceptable. These are the very people that we will all need to look after perhaps us or our loved ones in the weeks ahead. It's critical that by not stockpiling, by not selfishly shopping, by leaving those supplies for others too, that our health workers are able to get access to what they need to. These are the people that we will all be relying on more than we ever have done in the weeks ahead.
Okay, thanks. Nick Eardley.
Thanks very much. Secretary of State, many of the pleas that have been made so far have fallen on deaf ears. Is the government prepared to at some point intervene and perhaps introduce compulsory limits on what people can buy? And a supplementary question, if I may. Many people will be out and about today for a walk with their families and will see parks absolutely packed with other people. Is that safe, and should people be taking further measures to distance from others in public spaces?
I'll answer the first point and may refer to Stephen on the second. The reality is that most of the supermarkets are already of their own accord, and they've discussed this, putting limits on certain items. So I don't think it is necessary or appropriate for the government to dictate this. Different stores on different items are working together to identify what an appropriate limit is. Today, I'm asking everybody to respect what those supermarkets are doing. They are trying to ensure that their shelves don't go empty early in the morning, and to do that and achieve that, they are putting item limits for certain goods. And it's very important that everybody respects that. More food is arriving every day. There's no shortage of food production. The crucial thing is that we need people to calm down and buy only what they need, and to think of others when they are purchasing. John.
John Craig, Sky News. Mr. Eustace, hasn't more pressure been put on supermarkets by the decision to close pubs, cafes and restaurants? And a medical question, if I may, for Mr. Powis. We've broadcast on Sky News in the past hour an interview with a leading ear, nose and throat consultant, that's Professor Nirmal Kumar, who's revealed some new symptoms for the COVID-19, a loss of smell or taste. I'm not sure if you're familiar with this. And he says 2 of his senior colleagues are suffering from this, and he's very concerned about the risk to senior frontline medics. And I wondered if you were aware of this, and I wondered if what action you in your organisation are taking to protect frontline medics from these new symptoms.
On the first point, the truth is that there's already been a significant switch in the last 3 weeks to people purchasing from supermarkets rather than eating out. The further announcements that were made yesterday are judged necessary to control the progress of this disease, and in order to protect our NHS, that's why we've taken the further step of closing those public venues. But it's a relatively small amount, we judge, of the increased demand in supermarkets to date. The biggest increase in demand is from a small number of people who have been stockpiling certain goods. And indeed, we estimate that in the past 3 weeks, around £1 billion worth of additional food has been put into households that has not yet been consumed.
So on the question of symptoms, like many viruses that give infections of the upper respiratory tract, so that's the nose and the throat, there's a range of symptoms. The two commonest are by far cough and a fever, and that's exactly why they are the two symptoms that we are asking people to self-isolate if they get those symptoms. So those are the commonest symptoms. In terms of staff protection, it's incredibly important that staff follow the advice from the experts at Public Health England who have described the protection in terms of personal protection, protective equipment that staff should take. And of course, that is what will protect staff from getting the coronavirus.
And just coming back to the demand point, I think many of the businesses that service all as customers have operations right across Europe, and they can look and see what's happened to demand in the days post significant announcements like the one that was made yesterday by the Prime Minister. And what we've seen in Ireland, for example, is that demand spikes again after the announcement, but then now is beginning to actually trail off. So it gives a lot of comfort that that's what we're going to see here as well in terms of trends.
Carl Zinnin.
Thank you, Secretary of State. Carl Dinnan from ITV News. One for each of your experts, if you don't mind. Helen, first of all, you said the problem is people and lorries. What are you doing to address that shortage of people and lorries? Is there something government can do? For example, is this a job for the MOD, perhaps? One for you, Stephen, if you don't mind. I gather NICE has just issued guidance saying that doctors should base admission to critical care beds on the patient's chances of recovery. Are doctors already having to make those sorts of difficult decisions to turn some people away? And if it hasn't started already, how soon do you see that happening?
So shall I kick off? Certainly, in terms of people, what the industry is doing is making sure that everybody that can be put into the front line is being sort of redirected to ensure that we've all got the food we need. We've got examples of many people from head offices of businesses going into stores, into the warehouses in order to support their colleagues. And on the lorries, I mean, that was an issue in terms of driver hours. One of the areas that was talked about very early on with George and his team in ensuring that we had the flexibility to be able to increase the capacity within that bit of the supply chain.
I might just add on that point that we're also helping to facilitate discussions between retailers and those in the food service sector. So it's important to note that the decision to close pubs and restaurants and so on, that means that there is some surplus delivery capacity and indeed staff with expertise in food who could be redeployed from those companies to the retail sector, which is obviously seeing an increase in demand.
Have you had a request from the MOD?
So a request from the MOD for delivery? No, but we are obviously giving increasingly thought within government to how we will protect those who may be self-isolating because they're vulnerable, and I know that more will be said about this in due course.
So doctors and other clinicians are very used to having discussions with patients and relatives about treatment choices. And frankly, our aim is to make sure that we're in a position that those discussions are as they have always been. But the way we will do that, to be absolutely clear, is for everybody in society to follow the guidance that the government has given in reducing social contacts, because that will reduce the transmission, the spread of the virus, and will reduce the number of deaths and the pressure on the NHS. Yes, we are working night and day to increase capacity, but an increase in capacity and the reduce in demand that will come from everybody paying attention, young and old, to the guidance that's been given will give us the best possible chance that doctors and clinicians can have those discussions in the way they've always had them.
Harry.
Thank you, Secretary of State. You talk euphemistically of purchase limits and respecting these rules, but the track record of the last 2 weeks has been that people haven't actually been listening to the government until they're obliged to do so. Can you today rule out 100% any need for state-backed rationing of any goods in the coming weeks? And secondly, the Chinese authorities have led us to believe that they've almost wiped out coronavirus now, with no new cases daily. Have you seen anything within government, within cabinet, to suggest that those figures aren't necessarily true?
So on your first point, as I said earlier, all of the major retailers are working together and exercising their own judgment about where it's appropriate to put limits, item limits on certain issues. So toilet roll is one where, for reasons that are not really understood, there was a big spike in purchasing quite early on, despite the fact that toilet roll is made here in this country, and they're able to expand production very, very quickly. But that is an item where, to ensure the goods remained on the shelves, the supermarkets together took a position of putting an item limit. I think it is best for the retailers to flexibly come together and decide what the appropriate limit is for each item, because this is a changing scenario. And as Helen pointed out, we know from other countries, such as Ireland, for instance, and France, that once people have stocked up their homes, those who are concerned, once they have stocked up with some food, then actually this surge in demand starts to taper off. And when that happens, then the retailers would want to react flexibly to adjust the limits that they've put in place.
And can I pick up on that just before we hand over to Stephen? The relaxation in competition law, I think, has given the forum to be able to have the conversations amongst the different businesses, to share ideas, and then actually for each business to implement the thing that works best for their customer base. And that isn't necessarily the same for every business. I think where there are different issues and they need to all come together and do the same thing, then that may be appropriate. But I think in terms of sort of limits on individual items, what's happened so far is that individual businesses have really looked at the way that their business operates, the interactions that they have with their customers, and made sure that what they've done is the thing that's going to make most difference to that customer base.
And I think looking at those countries such as China that got this disease early, and their experience is that it is possible to develop strategies to suppress and to reduce the virus. Different countries take slightly different approaches, but to be honest, they all have the same scientific basis, which is to reduce the spread and the transmission of the virus in the community so that fewer people are infected. Fewer people who are infected, the fewer deaths, the less the pressure on health services. So the advice in this country, which follows that scientific basis and is on the best possible evidence, is it absolutely designed to suppress and reduce the virus and to reduce the number of people infected. So I think you can see strategies that have been effective. And I'll go back to what I said earlier. That's why it is absolutely crucial that everybody in the country follows the guidance that's been given. It's not for somebody else to follow. It's for you to follow. It's for me to follow. It's for everybody to follow. This is all our problems, And if we do it together, it will be an effective strategy. If you do it, if you follow the advice, you are saving somebody's life. This is the time in your lifetime whereby your action will save somebody's life. It's as simple and as stark as that.
Dave Wooding.
David Wooding, The Sun on Sunday. You've already told us how much has been stockpiled in people's houses. Is it possible, Secretary of State, to give us an idea, if panic buying continued at the current rate, how long it would be before we ran out of food in this country? And one little added to that, fresh fruits and vegetables, is there going to be a problem this summer with getting casual workers in to pick fruit and veg for the autumn?
Well, on the former point, as I said, and as Helen explained, the food supply chain is actually used to dealing with spikes in demand, not least every Christmas. There is a surge in demand, and in the last 3 weeks, they've seen surges that are similar to that. And food manufacturers have responded by increasing their production by up to about 50%. So we don't think there's no risk of food running out. The challenge we have is getting food to the shelves and keeping it there, which is why the supermarkets have taken a number of steps to coordinate their activities, and why we've taken a number of steps to make sure we can get more food delivered to more supermarkets more quickly. On your second point, it is the case that we will shortly be moving into a period from around May onwards when we start to get increased UK production. Some of the labour in agriculture moves around from different sectors, so there's already quite a lot of staff that will be working in fields in Lincolnshire, for instance, on the winter vegetable industry, and also in places like Cornwall. And we anticipate that we'll be able to provide the labour necessary to ensure that we can continue that harvest.
Can I just pick up on that? And I think what we all need to recognise is that we may not always be able to buy exactly the normal things that we would, and that actually there will be, less choice than perhaps there has otherwise been. But there is. I mean, I was in my local supermarket this morning, and I didn't get my normal list of my shop, but there was plenty of other things that I bought instead. So it wasn't like there was nothing available. And I think the thing about capacity, we've certainly seen that the production capacity has increased by about 50%. And even on the phone this morning, many of the businesses that also have manufacturing and producing as part of their supply chain are saying that they are now looking at how they can continue to grow that over the coming days and weeks.
David.
Thank you. We've heard reports of how ready-made pies are being sold online, sometimes for around £30, which is something no one ever expected to see. Are you concerned that actually profiteering could be going on? And if needs be, is there a plan to tackle profiteering, and perhaps in the worst case, if it gets to looting? And is there a plan that's ready-made if rationing does need to be introduced?
Well, I might ask Helen to comment on this point, but I would just say this. Over the last 2 weeks, I've been in almost daily contact with all of our major retailers. They are working in quite challenging situations and have really stepped up and worked collectively to ensure that we get food to people. We've not seen any widespread evidence yet of that kind of increase in pricing, but obviously we keep a close eye on that. I think the most important thing, as Helen said, that we envisage this being a temporary spike in demand. If other countries are anything to go by, those people who feel the need to stock up once they have demand will start to settle back down. But Helen, I don't know if you want to say anything about that.
Yeah, I mean, I have been working in the food and the wider retail industry for more years than I care to remember, but I can guarantee you that the competitive nature that across the industry is as robust today as it always is, and that is what has enabled us all as customers to make sure that we continue to see great value in prices from our retail businesses. I think all of the conversations that are being held are absolutely about making sure that we all have access to the food that we need, working with government on the things that would facilitate and enable the changes to regulations that would facilitate and enable that to occur more effectively, and get those lorries and more capacity available so that the shelves get full.
Nigel, take.
Nigel Nelson, Sunday Mirror. Secretary of State, that the Prime Minister talks about doing whatever it takes. I'm sorry, this is another rationing question. But how can you actually rule out entirely that we may end up with some kind of rationing, or indeed even ration books?
Well, the point that I made earlier is that the supermarkets are best placed to judge what stock item limits they should place on their particular product lines in order to ensure that they can keep food on the shelves. But there's no shortage of food. As I said, food manufacturing has geared up to meet an increase in demand, and it's up by 50%. So we think it is better for individual retailers to make individual judgments or judgments collectively about particular lines that go off the shelves most quickly and where they may want to take action. Yes.
Henry Bodkin from The Telegraph. Secretary of State, looking back briefly to yesterday's economic announcements, it's increasingly clear that the group that is still most worried are the self-employed. Is there anything that you can promise them? Will there be any more announcements coming down the line to give them some hope that they can get through this? Secondly, looking back to today's food-related stuff, is the government anticipating any supermarket individual store closures as a result of staff absences, staff going sick? And in that scenario, or indeed in any other scenario, is the government planning to step in to help coordinate local stores and local supermarkets? Thank you.
Look, on your first point, the Chancellor has made a number of quite dramatic interventions over the last couple of weeks to help tackle this particular pandemic, including yesterday, obviously, a package of measures to help businesses. I know there are other issues that have been raised, and it's obviously for the Treasury to keep this matter under review. On your latter point about staffing in supermarkets and the food supply chain more generally, we obviously have designated those working in the food supply chain as key workers, and we believe that there will be sufficient resilience having done that, particularly since some are recruiting staff that have been laid off from other establishments in the food service sector. We believe that we will be able to meet those staffing requirements even with the expected absentee level.
And can I just build on that? I think certainly from the retailers' point of view, they are absolutely committed to doing everything they can to keep the stores open. And examples of closing deli counters, people from head office coming in to provide support, I think are ways that will seek to mitigate any particular shortages that might otherwise cause a store to close. And I think that's a great opportunity, really, to call out to all the people who work in retail businesses, who work right across the supply chain, who I think have been doing an amazing job over the last couple of weeks in working superbly hard in ensuring that we all have access to the food that we need.
I'm going to take two final questions very quickly, though, if we can.
Thank you. Fatima Manji, Channel 4 News. Secretary of State, a week from now would have been the beginning of school Easter holidays. There will be many families who still have holidays within the UK booked up, cottages by the sea and so on. What is the government's advice to families about those holidays? Is it safe to travel between towns and cities and to the countryside?
Well, the advice, obviously, that we've given so far is that people should be socially isolating, and the whole population should be limiting as far as possible all of it. Social distancing, and so the whole population should be distancing themselves as far as possible. Final question here.
Lizzie Buckham from The Independent. Secretary of State, food banks are struggling to provide for the most vulnerable, with some closing their doors. Would the government bring in any measures to protect them, perhaps exempting them from restrictions and allowing them to buy in bulk?
Look, we are in discussion with all of the supermarkets to try to ensure that food banks retain an access to food supply to help the most vulnerable, and it's a piece of work that we've been working on for the last week, and there will be more that we'll say on that in the coming days. Thank you all very much for your time. Thank you. Bye.